Hi, my name is Jennifer, and this is my presentation on acute glomerulonephritis. So, for the pathophysiology of this condition can be triggered by infections such as bacterial or viral infections or by autoimmune disorders. The body forms antigen slash antibody complexes in response to these infections, and then these autoimmune complexes then travel to the glomerular tissue. On the other hand, certain pathogens can just make their way into the glomeruli and may deposit themselves there through direct invasion. Both of these mechanisms lead to an inflammatory response, which leads to hypercellularity. And neutrophils and monocytes can infiltrate their way into these tissues and cause worsening of the inflammatory process. All of this swelling can cause swelling of the glomerular endothelial cells, which then can cause narrowing or obstruction of the capillary lumens and then reduces the filtration of the kidney. And then what is seen is a decrease in urine output. You can see protein in the urine and even blood in the urine. So for the transmission and causes of the disease, so there are various conditions that can cause the acute glomerulonephritis. The most common is strep, is group A strep, uh, often after a strep throat or skin infection like impetigo. Other bacterial causes include the Staphylococcus aureus and viral agents such as hepatitis B, hepatitis C, the varicella zoster virus, and HIV. And parasites can also cause this condition, such as the Plasmodium, which causes malaria, and autoimmune conditions, especially lupus, can also lead to this condition, and even metabolic conditions such as diabetes. So this condition causes inflammation of the glomerulus or glomeruli tissue, which leads to poor filtration and retention of fluid. Uh, that's why three major nursing diagnoses that apply to patients with these cases are as follows: excess fluid volume related to ineffective glomerular filtration as evidenced by oliguria. Intake exceeds output and dyspnea, and the dyspnea would be secondary to fluid in the lungs. For number two, impaired renal function related to decreased glomerular filtration as evidenced by decreased urine output, elevated creatinine levels, and elevated potassium serum levels. For number three, it's electrolyte imbalance related to excess fluid retention as evidenced by sodium serum levels of 125 milliequivalents per liter and elevated potassium levels. Um, and then for the three interventions for each of these nursing diagnoses, for the excess fluid uh, nursing diagnosis, we would administer diuretics as prescribed, monitor electrolyte levels, monitor fluid intake and output. For the second one, which is impaired renal function, we will monitor vital signs when there's a fluid retention and increase sodium levels. At the beginning of this condition, it can cause an increase in blood pressure, and that's why we have to monitor blood pressure to make sure that we can administer antihypertensive medication as prescribed. We have to monitor the BUN, creatinine, and electrolytes to monitor how the kidney function is trending. And then we also have to monitor the fluid intake and output. For number three, that's the electrolyte imbalance. We have to administer electrolyte replacements as prescribed, monitor for changes in consciousness, and monitor for dysrhythmias. For the treatment plan, um, it is tailored to the cause of the condition. If it is caused by a bacterial infection, then we would have to administer the antibiotics. For those who have hypertension, we have to make sure we give them their antihypertensive medications. And in case this glomerulonephritis is caused by an autoimmune condition, we have to give the autoimmune suppressants and corticosteroids to decrease inflammation. We also have to give the diuretics as prescribed, and in severe cases, they might even prescribe or recommend dialysis or plasmapheresis. For the nursing care impact on outcomes. So nurses play a critical role in improving outcomes. As nurses, we have to administer medications correctly, track fluid status daily, monitor labs, and look for signs of complications. For complications, we have to look for a condition called uremia, which is an increase in the nitrogen waste that accumulates in the body because it's not being filtered out. And we have to look for signs of changes in consciousness, nausea, vomiting, or fatigue, and report those to the primary doctor. And we also have to make sure we educate patients on diet changes, the importance of taking medication as prescribed, and making sure they uh, look for signs of fluid overload. And two questions for those viewing this presentation are what other nursing diagnosis applies to patients with glomerulonephritis, and how can diabetes lead to this condition? And that's all. Thank you.